That's great. Good morning, everyone. My name's Mike George, and together with my colleagues Rebecca John and Tim Morgan, we are the Wales General Ophthalmic Services National Clinical Lead. And that means that we're optometrists, leaders focused on guiding teams in primary care and ensuring high standards across NHS optometry. We're sort of the bridge between optometrists who provide clinical practice and health policy as defined by Welsh Government. I'm here to talk to you about WGOS signed orders and how they enable NHS optometrists in Wales to treat urgent eye problems. And I suppose from the outset, it's worth saying that signed orders are called that for various legal reasons, but they're basically like NHS prescriptions. And when I say optometrists, I'm talking to about 90% of the population of opticians in Wales are optometrists, and the other 10% are dispensing opticians. So when I say optometrists, lots of people just think opticians. It's most opticians are optometrists. So in this session, I'll go through why signed orders were introduced and what a signed order is and is not, and then when a signed order may and may not be used. And I'll also talk about the WGOS signed orders formulary and what patients and members of the public may need to know, some clinical scenarios for you, and then an oversight how the oversight of WGOS signed orders is set up and what their benefits are. So WGOS signed orders were introduced to address a long-standing gap in our primary eye care pathways in Wales, where patients examined by optometrists sometimes needed to see another healthcare professional solely to obtain a medical prescription. And this duplication created avoidable pressure on GPs and some of our independent prescriber optometrists, also pharmacists, and urgent eye services in hospital departments. So signed orders support the Welsh Government's policy aim of delivering more care close to home, making best use of NHS Wales professional skill mix and reducing unnecessary handoffs within the system. So from the 1st of April this year, community pharmacies in Wales have been able to dispense approved medicines and appliances requested on a WGOS signed order, allowing treatment for patients to begin promptly after they've seen their optometrist. A WGOS signed order is a formal written instruction issued by an optometrist following an NHS episode of care in a high street optometry practice or a mobile service that might be seeing a patient in their own home. And these could be routine or acute eye examination services, or patients who attend our low vision services if they've got vision impairment, or for our specialist services with patients with medical retina and glaucoma conditions. The signed order authorises a Welsh community pharmacy to supply a specific medicine or appliance that appears on this nationally approved WGOS signed orders formulary. That's the list of things that can be written on a signed order. It's important to note that a signed order isn't a GP prescription or another prescription for various legal reasons, and it's not interchangeable with GP prescribing. Signed orders operate within a clearly defined scope and a governance framework, and can only be issued where there's a clinical need identified during an optometry examination in WGOS. The supply is NHS funded and patients do not pay a charge for the medications. And the intention of signed orders is to initiate or change treatment, not to provide ongoing or repeat prescribing, which remains the GP's function. Typical conditions that may be treated include things like dry eyes, eyelid inflammation, and eye surface trauma. WGOS signed orders can be issued when a patient is receiving any episode of care in WGOS and the optometrist identifies a need. And so while signed orders are commonly associated with urgent eye problem assessments, they can also be offered during other appointments in NHS optometry if the need arises. There are several circumstances in which a WGOS signed order would not be used. So they can't be used during non-NHS consultations. I'm sure most of you know that optometrists do some private work in their practices, and these are only for use in the NHS. And they must not be used to generate repeat prescribing, so that remains the GP's work. They can't be used to in like a workaround way to give something that's not on the formulary or that's not within the optometrist scope of practice. So specialist treatment by independent prescriber optometrists and ophthalmologists in hospitals have remained separate to these. And they're definitely not for the ongoing management of chronic conditions where prescribing responsibility sits with the patient's GP or ophthalmologist, but sometimes they're used to initiate or change treatments for some chronic conditions. The WGOS signed orders formulary sets out the list of medicines and devices that may be prescribed, supplied on a signed order, along with their indications and usual place in the treatment pathways, so that optometrists operate in a consistent way across Wales. It focuses on eye conditions that are appropriate for management in primary care on the high street and in people's homes, and it includes antibacterial eye preparations, anti-allergy treatments, cycloplegic agents, which are things that relax the muscles in the front of the eye for specific indications, and a range of lubricants, so things that make the eye wetter. Preparations are listed by generic name to support flexibility in dispensing by the pharmacist and reduce the impact of any supply shortages, and also to make it clearer when optometrists communicate with GP colleagues or other providers of care. And the formulary is listed on AWTTC's website, and the link to that is that tiny blue thing on the bottom of the screen. And if the slides are shared afterwards, you would be able to click on that and take a look at it. So when a patient presents their WGOS signed order from the optometrist to a community pharmacy, the pharmacist dispenses in line with the signed orders formulary and the NHS Wales regulations for pharmacy. It's treated as an NHS funded supply with no charge to the patient. Pharmacists can dispense any appropriate licensed generic equivalent of the item listed, taking into account what's available and what's clinically suitable. The signed order is valid for 6 months from the date the optometrist signs it. And if there are any concerns about what's written, the pharmacist would get in touch with the signing optometrist to query what was written. So at the GP practice, WGOS signed orders are intended to initiate or change treatment following an optometrist assessment, and they don't replace GP care. And optometrists are required to inform the GP of any medicines that they order or things that they change for the patient, including any advice to stop some treatment that the GP may have started. And so for GPs, this means that a notification should be expected to allow them to continue the patient's care and follow them up themselves if needed. And if a condition does turn out to be chronic and require ongoing treatment, then the optometrist will write to the GP to transition the need for repeat prescribing to the GP. But in most cases, for signed orders, the need is time limited and GPs won't be required to repeat prescribe just because a signed order is being issued. So here's some examples to help illustrate how WGOS signed orders are used. So if a patient's got viral conjunctivitis, which is inflammation on the front of the eye, making the white bit go red, supportive treatments such as lubricants may be recommended. So it's a self-limiting condition. It just gets better in a few days by itself. But for comfort, a lubrication regime may be started by the optometrist, and so that they may offer the patient a signed order. And in this case, the patient could take the signed order to the pharmacist, or they could say, well, it's only lubricant. I don't want to bother going to the pharmacist. I'll just buy some lubrication myself from the optometrist or from a supermarket or something like that. So they can make an over-the-counter purchase somewhere if they prefer for convenience. The second case, a patient presenting with pain and light sensitivity and reduced vision, which would suggest this thing called suspected uveitis. It's quite serious and requires prompt treatment. It requires specialist treatment. It's beyond the core competency scope of optometrists, and so a signed order would not be appropriate in that case. The patient would be referred to a specialist service the same day or the next day to get treatment. So signed orders are about proportionate care, not automatically getting medicines, and they sit within the context of clinical decision-making and optometrist scope of practice and what the patient chooses to do as well. Here's the governance system. So strong governance underpins WGOS signed orders. The signed orders pads, like prescription pads, have got to be stored securely. Any losses reported immediately to the health board. and optometrists would never sign blank forms in advance. Patients only get one signed order per episode of care in WGOS, but they can get multiple items on one signed order if they're required in that clinical case. Optometrists have got to keep good records. They've got to document their diagnosis, the allergy status of the patient, the advice the patient was given, and the signed order serial number in their patient records. And health boards monitor what's going on. They look at the activity through dispensing data and clinical audits. And this assurance framework provides confidence that signed orders are being used safely and consistently and in line with national policy. So WGOS signed orders provide a practical, evidence-based, clinically governed mechanism to improve local access to eye care treatments in Wales. And for patients and the public, the care is free, it's at the point of need, and it's timely. It means fewer delays and fewer handoffs between different professionals providing NHS Wales services. People may call their optometrist with an eye problem, be triaged on the same day and examined within a clinically appropriate timescale, and then get NHS-funded medical treatment if needed. For doctors and nurses in primary care, signed orders reduce unnecessary appointments with them for prescribing while maintaining continuity of care through clear communication. And most importantly, signed orders support a move to a more integrated primary care system where each professional group, the doctors, the nurses, the optometrists, the pharmacists, work at the top of their licence so that patients and people of Wales get the care they need in the most appropriate setting. So diolch yn fawr am wrando. Thank you for listening. I'm happy to take any questions now.